Hello, everyone, and welcome to Biohacking Conference 11. I'm Dr. Jeff with ReCELLebrate, and I'm honored to be able to present to you again and be invited to participate in this event for the second year in a row. I'm from ReCELLebrate. We are a regenerative medicine cutting-edge practice based in Las Vegas, but we see people from all over. And I hope you learned something from this today. And if you have questions, please reach out to us afterwards. We love to meet new people and educate further. Let's jump right in. So welcome to the Upgrade You. Regenerate yourself with stem cells and exosomes talk. This is all about healing naturally like your body has known how to do your entire life. Many can benefit from the restorative assistance from stem cells and stem cell derived exosomes, and we'll explain what those are. And this is what we call regenerative medicine. It helps us tap into our own biology to renew, restore, and heal, especially if we need a little help in the later years or been exposed to a lot of chronic inflammatory stresses. We have stem cells throughout our life. They help us grow and develop, and they help us maintain and heal as needed, replacing tissues. But as we get exposed to the factors that cause our cells to age and we're damaged, they become less useful, exhausted, some would say. This is what happens when we have a stem cell decline and then we can't heal as well. Well, we now have the tools to sort of compensate for that, and that's what this talk is about. So our cells do collect and must defend against our environment, and that's what chronic inflammation is. It is the root of most diseases. It is the root of cellular aging and our aging. And to slow this process, we need help from biological signaling in our body, from cell to cell, from different mechanisms, and that's where regenerative medicine comes in further. Now, the problem with this accumulating inflammation is it causes our cells to age. We get more senescent zombie cells. We have less functional stem cells in our body. They just can't help us as they used to. They're exhausted. Even our regular cells are less functional and cannot be replaced as readily. And when these things happen, we get disease. We get inflammation causing aging, and aging contributing to more inflammation. So how do we fix that? How do we slow the inflammation process and the aging process with it? And how do we delay or prevent or even reverse disease related to that inflammation and aging? Well, we can do that. And we can do it in some ways without pharmaceuticals, without steroid injections, without surgery. And I mean, some would say, well, why don't we just take a bunch of anti-inflammatories? Well, the problem with that is those are pharmaceuticals, and the pharmaceutical anti-inflammatories only work on one aspect of inflammation, and the other pathways then overcompensate. So that doesn't always work great, although it is a short-term solution maybe for a certain type of inflammatory pain. Now, I've heard of stem cells, right? People say, what are these things? They sound cool. I know they can do cool things. My doctor did not offer them. You're right. Listen, I've been practicing for over 26 years. I was not originally trained in stem cells. It's still not a part of most medical school curricula. And I had to go back and be open-minded to retrain and relearn this stuff a number of years ago. So it's okay if your doctor doesn't offer these. That just means you need to sometimes get an extra opinion. So where do you get these cells? What are they? Well, they can come from your own body, and they can come from a donor. And the donor, the best donors are the ones who have not seen any damage, stress, or inflammation. And those are the perinatal donors. Now, you can use your own cells, your own stem cells. They can be concentrated and put back in the right way. But you don't really put the oil back in your car when you're changing the oil. So I'm more of a fan of the more active, youthful, day zero stuff fresh from a donor. And these come from C-section births. They're planned C-sections in screened, willing mothers here in the U.S. who have not had the COVID vaccine. And they are screened and tested for all viruses. They go to a lab. They're quarantined. They're tested for endotoxin. And the process by which they're donated and collected, screened, tested in those labs are all certified by the FDA. So what is it about the amniotic fluid that makes a baby, right? This is sort of the factory, stuff. There's nothing better than that fresh car out of the factory, or a new pair of pants you bought at the store. They're just perfectly folded and creased, and the fabric is untouched. Everything's perfect. the amniotic fluid carries a lot of that when we talk about a human. And I noticed something during my residency a million years ago, and that if we did surgery on fetuses, that's right, we go in the womb and do a surgery to close up a spina bifida, for example, because they had better outcomes if we closed that earlier. Some of the babies would come out with sometimes minimal, if not no scarring. And that occurred to me, and I'm tapping back into that now in regenerative medicine. There's something magic about the amniotic fluid. Well, since I gave this talk last year, I did a little homework, and I found this in my files. This is from the Annals of Surgery in 1992, Scarless Fetal Healing. So I wasn't the first to identify this, and this is from UCSF, and they identified at that time that fetuses that were later born didn't have scars. So there's something really great about what is in the amniotic fluid and what it's doing. So what's in it? Well, tons of abundant youthful stem cells, as well as proteins, collagen, growth factors, and extracellular vesicles. So let's not skip over extracellular vesicles. So what happens to stem cells delivered to our body? We'll come back to the vesicles. Well, they last about 10 to 14 days if we put them in your vein. But the benefits last much longer, or some of the benefits are even permanent. So what happens if stem cells are gone? What's doing the work? Well, it turns out our cells do the work. They are signaled by the stem cells through those extracellular vesicles, which are cell-to-cell communicators from the stem cells in the amniotic fluid to our cells to change what our cells do, reprogram them back to a more youthful, restorative state. So cells can communicate with their neighbors through peptides. We make our own peptides, even though we now are tapping into the therapeutic field of peptides as well. And vesicles, these extracellular vesicles, they are sort of let out as a small bubble of information with a little membrane. They get peptides, they have mRNAs to reprogram what's going on in our cells. Instead of our cells being busy in the inflammation mode, fighting against the environment, we go back to factory settings. Restore, maintain, this is the youthful signal in the amniotic fluid. All cells make exosomes, but it's these stem cell derived exosomes in the amniotic fluid that we really like. And these come from what are called mesenchymal stem cells that are found usually in the umbilical cord, but circulate also in the amniotic fluid. And other sources of exosomes might be PRP, stem cell preparations themselves, and, like I said, amniotic fluid. So the exosomes derived from these stem cells, from the MSCs, are available in the U.S. from donors. They're fully screened and tested. Like I said, it's an FDA certified and compliant process to prepare them, and the donors that we use have not had the COVID vaccine. Now, don't worry about this busy picture here, but this is an exosome. It has mRNAs, it has special peptides, it's got heat shock proteins. So remember, when you go in a hot sauna and your body releases these survival proteins that help clear out senescent cells and improve your health, those heat shock protein is one of them. Well, they are in stem cell-derived exosomes, so that's another way you can get some of these signaling. And exosomes, there's no rejection, they're immunoprivileged. They don't really have much in terms of surface markers to look foreign. They don't now have to be matched or anything like that. They're much smaller than cells. Cells are small enough, but these will pass through the blood-brain barrier. So stem cells don't get into your nervous system unless they're put there, but exosomes will. And they do have anti-aging, anti-inflammatory, epigenetic influence. They tell what genes to be called upon, the anti-inflammatory restorative genes. And that's how they work. They take our cells from defense mode into an optimal, functional, healing, restorative, youthful mode through this sort of cell-to-cell communication using these vesicles, these exosomes for short. So they work as a factory reset to our own cellular processes, what we call cellular metabolism. I call this stem cell activation. We activate our stem cells, we activate our own cells. Let me give you an example. You ever notice how a pregnant woman has glowing skin and her hair is growing robustly and her nails are growing, and usually she's in a good nesting mood, and things tend not to hurt except maybe the low back if they're carrying a lot. But what this is, it is a daily dose of exosomes that can cross through the placental barrier. She's not getting stem cells, she's getting exosomes. Well, we're tapping back into that by using these in a therapeutic manner. where else can you get exosomes in the world besides the amniotic fluid? Well, turns out there are plenty of plant-derived exosomes out there. Now, it's hard to get enough. You'd have to eat a ton of fruit and vegetables. But we now have a product of certain fruits that support the anti-aging process that are highly concentrated, and that's called Longevix. So please stop by our booth. We'll show you that. We have, you can have bone marrow and bone broth are rich in exosomes. Chicken soup. Well, why in most cultures do your grandmothers make you chicken soup if you're sick? Because the exosomes from the chicken bone stock in that will help you heal. And then colostrum or mother's milk is the other source. So there are products out there, of course, in the colostrum angle for that. So these are ways you can get healthy, good signaling exosomes aside from amniotic sources. So as I mentioned, the Longevix product is from our company, and it's plant-derived exosomes, 1 capsule a day, to help stimulate your healthy cell activities. And this has been shown to improve the antioxidant health of your cells, which of course helps you repair DNA, improves your cell metabolism, improves clearing out senescent cells, etc. Moving on, there's a lot of background on plant-derived exosomes, but that would be a great way to help support your health as a supplement. But let's get into some more interesting things about applying these strategically in a medical setting. So stem cells compared to MSC or mesenchymal stem cell-derived exosomes, let's compare them. The main mechanism of action is that stem cells are really delivering the exosomes. When we're skipping to the exosomes, we're skipping the delivery mechanism. Exosomes are delivering the effective cargo, the medicine, the business end of stem cells. The risk of rejection of stem cells is minutely small. I've never seen it, but it's absolutely de minimis with exosomes. It's just theoretically not even considerable. IV distribution of stem cells. If you have an IV, the stem cells get preferentially taken up by the heart and lungs, so the body doesn't get as much. That's not true for exosomes. They're so small, they're part of the body's plasma. They can go everywhere in the body, including the nervous system through the blood-brain barrier, which is the next element here. And then the exosomes are much easier to handle and store. They only need to go in a -30 centigrade freezer. And the cost is much less for the exosomes when compared to stem cells because amniotic fluid is so abundant, but umbilical cords are not. So the FDA, I should say, does regulate regenerative biologics, and the FDA has not approved any marketing claims for PRP, stem cells, exosomes, or anything like that. We cannot make any claims, so everything you're learning here is for educational purposes. We will show you some examples. We're allowed to do that, but I can't claim that we're curing or treating a disease or condition based upon the current FDA status. That doesn't mean that these things are disapproved or unapproved. And remember, the FDA does not regulate what doctors and patients agree to do with good informed consent based upon science. We're not shooting from the hip here. Everything we do is based upon some good work that's been done, and I'll show you some of that. Also, you should know that some states are now moving to approve the use of stem cell-derived biologics like exosomes, stem cells, things like that. State of Utah was first. I believe the state of Washington and Arkansas have followed, and I think hopefully more will follow as well. So if you hear if your doctor tells you it's illegal to give stem cells, that's not correct. That's not correct at all. It is not compliant to make a claim that stem cells can cure something. It's not illegal, it's non-compliant. Okay? So let's move on. By the way, in Europe and in Asia, they've been doing this for over 20 years with great science and long-term follow-up. It's an approved process there. So we're just way behind the times. Currently available applications, at least things we're doing, is we help people address their joint osteoarthritis, osteoporosis. We can help with bone density, typically, again, for educational purpose, metabolism of tissues, like helping kidney function, helping pancreatic function in cases of, let's say, diabetes, gland dysfunction, sexual dysfunction, there are applications there. We have cosmetic things for skin and hair, autoimmune, hyperinflamed states. There's nothing more anti-inflammatory than stem cells and stem cell-derived exosomes. We can also assist with peak performance. Athletes, people want to get a little more out of their recovery, which sort of falls into the anti-aging side of things, the biohacking side. We've seen benefits in helping people recover from a health event like a heart attack or stroke, and also with assisting bone density and muscle mass. Moving on. Let's talk about osteoarthritis, wear and tear, cartilage degeneration, aka chondromalacia. This is really a metabolic process involving the health of the joint. So the cells that make cartilage, the bone edges, everything surrounding there. Now, we know this because if you take probiotics, vitamin D3, omega-3s, eat a clean anti-inflammatory diet, we can show improvement in joint pain and improvement in joint degeneration. Well, sometimes that's not enough for people, and we have to take it to the next step. And that's where people with arthritis, osteoarthritis, bone on bone, wear and tear, or what we call chondromalacia, may benefit. Now, if you look closely at that joint, the cartilage is a protein. It's a collection of proteins. Just like hair is a collection of proteins produced in the scalp, cartilage is a collection of proteins produced in the bone. Now remember, when you were growing and making that joint as a fetus and a child, the growth plate, the cells in that bone called chondrocytes, were making the cartilage. So remember, the actual party, the biology is happening in the bone edge. And when you look at the stages of degeneration of a joint, for example, it is a bone problem. So why do we keep treating the cartilage? Why do we keep injecting that? It makes no sense. So at ReCELLebrate, I do precision targeting. I don't just inject willy-nilly. So if you take a look at a high-quality MRI, and I ordered some special sequences here, you see a knee, front view of a knee, and you see the cartilage layer is thinned, but what you really see is this cranky, bright, inflamed bone marrow here. Now here's a normal for comparison. The bone marrow should all have this uniform gray color. Here, there's something wrong, and that's our target. That means those cells can't produce cartilage. They're cranky, they're upset, they're unhappy. So remember, the joint space, the cartilage, there's not a lot of cell activity there. If you put exosomes in there, stem cell-derived exosomes, to try to stimulate the cartilage, you might get some benefit, maybe some anti-inflammatory benefit, but the cell activity is in the bone edge. Now, this sounds weird, right? How can I help my cartilage if it's in the bone? Well, somebody figured it out way before me. I'm just applying it. And that's been an over 20-year experience in France from a Dr. Philippe Herngu, who found that he took stem cells 20 years ago. Now, they didn't have exosomes at the time because they weren't around. Took stem cells from patients' own bone marrow. So not only did he not use exosomes, but he used their own aged bone marrow and stem cells from the bone marrow. And he injected half the patients in the cartilage and half in the joint, the bone edge at the joint. Now, he took patients that were already recommended knee replacement. He said, hold on, before you have that big surgery, would you like to join our study? And a lot of people signed up. Here are the results. Stem cells were shown to prevent the need for knee replacement for over 15 years in over 80% of those injected in the bone edge. But at the 15-year mark, only about 20% in the joint, in the cartilage. So really, let's look at that closer. The people, the better group, the group that did better was the blue plot. Those who had the implantation of stem cells in the bone edge just adjacent to the cartilage. Those in the joint, intra-articular, is the red plot, and over time, they started having problems again. Now you might say, well, can they just then have another injection? The answer is yes, but this study wasn't looking at that. It was looking at which group did better in the long run. So the vast majority of these suffering from painful joint problems can really be potentially helped, and that's what we're showing and doing in our practice, and this is by addressing the bone marrow cells. Does this improve cartilage? Well, let's do some show and tell. So here is a 52-year-old woman back in 2021, prior arthroscopy surgery, prior sports injury. Radiologist read her MRI as grade 2 to 3 chondromalacia, which means wear and tear of the cartilage, of the medial femoral condyle, which is called the medial compartment, the inner compartment of the knee where the meniscus is, and grade 2 chondromalacia of the patella behind the kneecap. So here's the side view. The cartilage behind the kneecap is this reverse J of gray color. So when you bend your knee, the kneecap here glides along this cartilage. So that was thinned, and she was having pain coming down the stairs, wearing high heels. After sitting for a while, she was quite stiff. So her doctor years earlier said, when you're ready, let's do a knee replacement. And she was trying not to do that. So in about June of 2021, I injected the medial compartment and the kneecap bone, intraosseous, in the bone, with the stem cell-derived exosomes from amniotic fluid. She started feeling better because there's an initial anti-inflammatory benefit. But many months later, she continued to do better. And at some point I said, do you mind if I get an MRI? I'd like to see what it looks like. So she was feeling good. And this was about a year and, I see June, a year and 4 months later. The radiologist read this as mild cartilage irregularity. Didn't even give it a grade. Remember, there's a up to grade 4, where 4 is the worst. It's bone on bone. So she went from a grade 2 to 3 down to a no grade. So I said, well, conservatively, it's no worse than a grade 1. But look at the thickness of that patellar cartilage. This is the reverse J in gray. And I highlighted it for you on the next slide in yellow. So this was before, and this is after. So you can see that she now has a more thick and juicy cartilage that she regrew after those injections. So yes, we can help someone regenerate cartilage by addressing the bone, and with it help reduce pain, reverse degeneration, and improve the health of that joint. Maybe keep that person from having a knee replacement or another. It doesn't have to just be a knee. We address all kinds of joints. And usually this is a one and done, one time. Because do you really want this open surgery, your knee filleted open, a bunch of hardware placed in there if you don't have to have it? How are these done? Well, they're done under sedation because it is a bone injection, and under targeting based on the MRI. I can go in here using fluoroscopy and put it right into the bone exactly where it needs to go. So I do an MRI beforehand. I use a very 3 Tesla high resolution MRI, and we have addressed foot and ankle, elbow, hip, shoulder, hands, fingers, and more. There are 520,000 shoulder replacements in 2023. There are 60,000 hip replacements in 2024 expected. I don't have the up-to-date numbers from last year. And we can even look at the spine, right? Here's an example of an MRI showing the bone marrow changes because those cells are cranky, they're inflamed, they can't do their normal job, which is to make the cartilage involved in surrounding the disc. So that's when you lose the cushioning properties. 2 different types of MRI. One shows the bright inflammation, one shows it as a dark. So those are my targets for someone like that. It's the bone. We've been missing the target for too many years. So degeneration is not just structural. It's metabolic. It's cell activity. Degeneration is not only seen there, it's seen at the subcellular level. And regenerative stem cell medicine, like the exosomes I'm talking to you about, is to suppress the inflammation, reprogram those cells, and help fight against degeneration. And the opposite of degeneration is regeneration. Did you catch that? If you are not degenerating anymore, you're regenerating. If you're not regenerating, you're probably degenerating. So let me help you regenerate. So the cellular health and anti-inflammatory effects of these types of things can help glands, for example, the pancreas, the kidneys, the liver. We've addressed dry eye syndrome in the eyelids. We've done post-irradiation syndrome for the salivary glands. People have had that. These types of regenerative biologics help support the immune system, fight against abnormal cells, infections, cancer. We've seen benefits in the neurologic system, metabolic problems, and helping just to build resilience and tolerance as a preventative. Different types of diseases involving hyperinflammation, autoimmune, Crohn's, IBS, vasculitis, rheumatoid arthritis, thyroiditis, etc. Other hyperimmune states are listed here, and these are where the body is just having too much inflammation and we attack ourselves. Well, what if we could suppress that naturally, biologically, without pharmaceuticals that have side effects? Also related to inflamed states are certain infections like Lyme's disease and long COVID syndromes, which we're now seeing. So these regenerative biologics are very powerful anti-inflammatories at a natural level. They work at the source of the cell activities and not just the symptoms of inflammation. So let's look at aging as another example here. So aging is this accumulated chronic inflammation or inflammaging. And you take two 70-year-old women, and one has, had a clean anti-inflammatory diet, has eaten fewer foods with preservatives and dyes, has been exercising, staying away from electromagnetic fields, all the good anti-aging, biohacking, and natural anti-inflammatory effects. And one hasn't. Has had a normal American diet, lots of preservatives, pesticides, things in the water, electronics, all kinds of things. And they're both 70, but they look very different on the outside, and they look very different on the inside. Their cell activity, their inflammatory markers are very different. So how can we be more like the youthful 70-year-old here? Well, we can use regenerative medicine to help suppress that inflammation. And if you suppress that inflammation, you help reduce the number of cancers. You help reduce the symptoms of arthritis, as I showed you, other diseases involving inflammation and aging. And remember, most diseases that we see, particularly in the older years, are diseases of aging. They have an inflammatory component. Alzheimer's is an example. Parkinson's, MS, frailty, loss of muscle mass. Remember, muscle mass is associated with longevity. Type 2 diabetes, all kinds of things can potentially benefit from the anti-inflammatory effects of regenerative medicine. So some other uses we have is in the aesthetics field. We have cosmetic uses for thinning hair, for skin rejuvenation. We have that for bone density improvement, because no one wants to fall and break a hip, because that can take you away from exercise and take you away from other anti-aging activities. Improve muscle mass, improve sexual function. So it also helps in prevention. So biohacking health span. Those of you who are here at this meeting might want to live to 180 or more, as Dave says. So we should have all the strategies in front of you that you might tap into. This can help to slow and prevent and reverse the diseases of inflammation, as I noted. And you can work towards achieving your optimal cell performance and health performance and athletic performance this way. And what about cancer? So we didn't say much about this last year because we didn't have our hands on it, but there's regenerative immunotherapy now. And these come from natural killer cell-derived exosomes, or NK cell-derived exosomes, different than the regular stem cell-derived exosomes. So what are these, briefly? These are a very small percentage of our immune system, these NK cells, and their job is to go around and remove cancer and zombie cells selectively. They don't hurt our normal cells. So if you can get your hands on these NK exosomes, they could help you remove more of those, especially as we age and our NK cell population is declining, just like our stem cell population. So we're using these now to help as an adjunct to cancer care, injecting solid tumors, using them for circulating reasons to help prevent or keep someone in remission or in between cycles of perhaps more traditional therapy, or as an alternative. So that's an exciting area. We're one of the few clinics in the U.S. to have NK cell exosomes right now. They're very hard to come by because they're hard to populate. And the exciting news is opening later this year is our state-of-the-art mini CT scan based robotic injection center. We'll be doing most of our joint work and injections in this facility. It'll be in our clinic, which is in Henderson, Nevada, which is a suburb of Las Vegas. We'll be the only freestanding center to have these devices in practice. That's not part of a hospital using it for other purposes. This is precision regeneration, and this is what that device looks like. It's robotically controlled. It will come in and be programmed into the right positions, targeted exactly where we need to go onto the patient for the proper injection, using low radiation imaging, quick snapshot, acts as a fluoroscope, an X-ray, and a mini CT scan for 3D imaging. And I'll show you that in just a moment here, and then I'll move on. So when you move around the guided needle, it gives you in 3D space exactly where you're going. So the chance of error is de minimis, of hitting something you're not supposed to touch. And again, so now we're injecting the bones, not the joints, for the better results. As Dr. Herngu proved, we're going to be able to do this with even more precision with this device. So regenerative medicine is not the future. It is the now. It is the present. It's available. Thank you for listening to our talk and growing with us. I hope you have interest in this. I would love to talk to you. If you have more questions, please email us, call us, stop by our booth here in the tech hall, and feel free to reach out. We love to meet new people. You can follow us on Instagram and other social media, and we try to post educational material there all the time. Thank you so much for watching.